Okay guys, this is going to be our first video that's going to follow our guided notes on alterations of the renal and the urinary tract. So we're going to start by kind of talking very globally about what your kidneys are supposed to do, what their overarching functions are, and then from there we'll kind of launch into different areas of the urinary tract and different things that can occur in those areas. So I know that the urinary system as a whole, and AMP2 kind of gets the shaft. It's kind of rushed at the end. So I just want to do a quick reminder about what's the function of our kidneys. What's the major functions of the urinary system? Because we got to keep those functions in mind when we talk about how they can go wrong, right? Okay. All right, so some of the functions, obviously, your urinary system will produce urine, right, and then allow for excretion. So that's probably the thing that it's most famous for. But it also helps to regulate fluid and achieve balance. That's osmoregulation, which is important. So we've got excretion, which is great. Regulate fluid balance, that's osmoregulation. pH balance. We were talking about the role of your renal system in terms of working with your respiratory system to achieve acid-base balance, so we don't want to forget that role here. And then the removal of nitrogenous waste. So this is the piece that people usually need a little bit of a refresher on when I'm teaching this. They want to talk about, they don't really quite remember everything there is to know about nitrogenous waste. So I'm going to cover that first, and then we'll get right into kidney stones and uric different types of kidney stones. Okay. So one of the things we need to keep in mind, because nitrogenous waste products are very important, and they can be used as bloodborne markers for both kidney function and for liver function. So let's talk about them really, really quickly. All right, so once upon a time, long ago, when you took AMP1 and 2, you talked about different biomolecules. So you talked about things like carbs and proteins and fats that you ate, right? And what their structure looked like. And one of the things that you should have discussed, or probably did discuss, I hope, is protein structure. And one of the things that's important in proteins that we don't see in the other biomolecules is the presence of nitrogen. So nitrogenous waste is the result of protein breakdown. So when we eat protein-rich foods, one of the pieces that we kind of have to take care of is the nitrogen group associated with the different amino acids that make up that protein. So nitrogenous waste is produced by your liver. And when we do digestive system, and we're going to talk more about liver function, we'll see where you can use this process of production of nitrogenous waste and looking at some of the products associated with that production as markers for how well your liver is doing. So it's produced by the liver, but it's removed from the bloodstream by your kidney. Okay, so there are 3 different types of nitrogenous waste products that we want to talk about. Okay, each of them is produced by the liver, okay? But it's not a third. So we have 3 types of nitrogenous waste. You have ammonia, urea, and uric acid. Okay? In humans, we make the most of this one, of urea. However, we can produce some ammonia, and we absolutely produce uric acid. So your liver makes all three types, but it's not a third of this, a third of this, and a third of that. Most of our nitrogenous waste is urea. So we think about these from almost like a cost-benefit analysis. So ammonia, from a cost perspective, is cheap. It doesn't cost a lot of energy to produce ammonia, but ammonia, the pH is about 12. And so we could not carry large amounts of ammonia around in our bloodstream because the pH is so high it would cause toxicity pretty quickly. So we make some ammonia, but this is definitely not the winner. But it's the cheapest from an ATP perspective to produce. Urea kind of hits the sweet spot, okay? It's a little toxic, but it's a little more expensive to produce than ammonia, okay? Uric acid is the least toxic, but is the most expensive from an ATP and energy perspective to produce. So it requires a little bit more work. So urea is kind of our sweet spot, so it strikes the balance between toxicity and energy expenditure. Okay, so why am I telling you all this? Because you're going to see some of these things pop up as markers for both renal function, which we're going to talk about now, but also when we hit the liver, we're going to circle back to some of this because some of the products involved in the process of the production of nitrogenous waste can be used as markers of liver function as well. Okay, so let's get started with stones. All right, so kidney stones. Okay, there are different types of kidney stones. Some of them are listed on your notes. So kidney stones are renal calculi. These are crystals. They're little rocks of protein or other substances that will obstruct the urinary tract. So you can have a kidney stone in the kidney proper, in the ureter, or in the bladder, and then it would be classified as a bladder stone. The risk for developing kidney stones, there are many, many risk factors that are listed on your guided notes, but a big one is age. The incidence goes up with increased age. Being male puts you at higher risk, and if you have low fluid intake, it puts you at higher risk. Now, there are other risk factors that would be included, things like geographic location, diet, race, okay? But we're going to focus on these three. So, the most common type of kidney stone is calcium-based. But I am going to talk about uric acid stones a little bit as well. With kidney stones, it's all about the size, okay? So if a stone is small, the treatment for it is really medication for pain and we let it pass on its own. But if the stone is a little bit larger, then we have to look at different ways to get the stone to a smaller size so that it can pass on its own, okay? Depending on pH and temperature will tell us a little bit about perhaps the type of stone that we have. So for example, if you have alkaline urine, you're at higher risk for calcium phosphate stones. If you have more acidic urine, you're at risk for uric acid stones. Okay, so about 70% of kidney stones are calcium-based stones. One thing that is associated with this is hypercalciuria. So when you have elevated blood calcium. Someone who has elevated blood calcium, it could be through dietary intake, but what we want to remember is this, parathyroid hormone. Parathyroid hormone, remember, I hope from AMP2, is one of the hormones involved in calcium homeostasis. What parathyroid hormone does is it increases your circulating level of calcium. So if someone has hyperparathyroidism, they would be at significant risk for developing a calcium-based kidney stone. Okay, so let's talk about uric acid stones for just a minute. Again, uric acid is one of our nitrogenous waste products. Uric acid can also form stones, but one of the things it is also connected to is something called gout.
Don't have it.
All right,
Uric
so
acid sucks.
Jake's got the gout, so he's commenting right now. So
Don't get the gout.
your
Right.
gout is connected to the level of purines in certain food products, things like meat, certain seafood, certain types of alcohol, red wine, beer. And it's also thought that there is a genetic component to gout as well. When someone has gout, uric acid crystals tend to precipitate out into the joints. And what it can cause is very painful and profound inflammation of the particular joint where the uric acid crystals are present. So more often than not, gout occurs in the feet. So in places like the toe, for example, or just the top of the foot or the ankle. Okay. When someone has gout, the main symptom that they have is significant pain and profound inflammation around the joint where gout is occurring, to the point that it is painful to the touch. The skin turns red, it turns hot to the touch, and causes an intense amount of pain that some people report just putting the most mild amount of weight on it is completely unbearable. Okay, so what do we do for gout? There's a couple of different treatments for gout. So the two main ones. Now, if someone has a tendency to develop gout, obviously your first suggestion to them would be to avoid some of the foods that have these really high purine levels. So you'd want to avoid, consuming a lot of red meat, certain types of seafood. You'd want to avoid those as well. You want to cut back on your alcohol consumption. But for an individual who has gout, there's a couple of different treatments. The first one is called colchicine. Colchicine is a medication that will go after the inflammation. So it reduces inflammation and reduces buildup of uric acid. The other one is allopurinol. Now, allopurinol can be given to, this is two L's, I apologize. Allopurinol can be given to someone who does not have gout but has high levels of uric acid. So it can be used to treat elevated uric acid in a patient that does not yet have gout. Okay, what allopurinol does, and it has some challenges associated with it, is it decreases production of uric acid. So this acts at the level of your liver. And so one of the things that can happen with long-term administration of allopurinol is some people incur liver damage associated with that. So it's not always used as a treatment in some people, depending on other risk factors they may have for liver damage. Colchicine you can take after gout has already flared up. You don't take it as a preemptive medication. You take it after you've already got gout and you have a flare-up of gout. And then the colchicine is taken for several days until such time that the inflammation is reduced and you're feeling better. Okay? All right. So that was just a little sidebar on gout. So let's talk about symptoms of kidney stones. All right, so there are a couple of signs and symptoms for kidney stones. Probably the one that most people would identify with kidney stones is excruciating pain that kind of radiates through the lower part to mid part of the back. So through the sacral and lumbar region of the back, and blood in the urine. The presence of a kidney stone can be confirmed through a visual image, so something as simple as an x-ray in most cases. if someone has a kidney stone, there's a couple of different treatments that are available to them. So if someone is prone to them, okay, if someone is prone to kidney stones, there are a couple of different things that you'd want to recommend to them to get ahead of it. So the first thing would be to maintain a proper diet. But a big one, so you want to avoid the foods if calcium's the issue, right? We want to watch our calcium intake, for example. If uric acid is the issue, you want to avoid those foods that are really heavy in purines, just like a gout patient would do as well. But up your fluid intake, especially if you drink alcohol.
Double it down on the alcohol.
No, not double down on the alcohol, double down on the water. You all see what I'm dealing with? Okay. So if the stone is smaller than is on the small side, they'll simply let the stone pass on its own and give you some sort of NSAID for pain, okay? If the stone is a little bit larger, they can do either an ultrasound procedure or a laser procedure to break up the stone first and then allow it to pass on its own. Obviously for men, kidney stones are a little bit greater challenge because their urethra is significantly longer than women, right? A woman's urethra is around roughly 4 inches. Male urethra, I don't want to know your personal story, but remember there's a large part of the urethra that's embedded in the pelvic cavity moving up through the prostate to the bladder that you don't see, plus running through the shaft and the head of the penis as well. Okay, so for men, passing a stone is going to be far more of a challenge than passing a stone for a woman. Okay, that's going to end this video. The next one is going to take us through lower urinary tract obstructions all the way through to cancer.